Hi students, welcome to Learn Classic Education. Today we are going to read about female reproductive organs. So female reproductive organs. Now the female reproductive system consisted of the female reproductive system is responsible for reproduction, produces ova, that is eggs, and secretes female sex hormones estrogen and progesterone, supports fertilization, pregnancy and childbirth, consisted of internal and external reproductive organs. Function of the female reproductive system. Female reproductive systems helps in the production of the ova, that is the process is known as the oogenesis, secretion of estrogen and progesterone, transports of sperm and ovum, fertilization and implantation, nourishment and development of the fetus, childbirth and lactation. So these are the function of the female reproductive system. Now female reproductive organs. It consists of the ovaries, fallopian tubes, that is the uterine tubes, uterus, cervix, vagina. These organs are involved in the ovulation, fertilization, pregnancy and childbirth. You can see in the image, the top one is the prepuce, then clitoris, then frenulum, labia majora, labia minora, urethral opening, vaginal opening. Then there is the hymen, vestibules, lower to the vestibules. There is the fourchette, lower end. Upper one is the prepuce, lower end is the fourchette. Then posterior commissure, and then the lower hole is the anus. Now ovaries. Ovaries are the two almond-shaped organs located in the pelvic cavity. Primary female gonads, produces ovum or the eggs, secretes estrogen and the progesterone, regulates ovulation and the menstrual cycle. So these are the function of, this is what ovaries is. Coming to the fallopian tubes, the two tubes connecting the ovaries to the uterus. Fallopian tubes are the two tubes connecting the ovaries to the uterus. Length is approximately 10 to 12 centimeter. It is the fertilization usually occurs in the ampulla and it helps in transporting the ovum to the uterus. So the parts consist of the infundibulum, ampulla, isthmus and intramural parts. So this is the parts of the fallopian tube. Now the uterus is the hollow muscular pear-shaped organ. Normal size is 7.5 into 5 into 2.5 centimeter. Parts is fundus, body, isthmus. The parts of the uterus is fundus, body, isthmus, cervix. Fundus is the top part, then body, isthmus, and in the lower part is the cervix. Now the layers are the endometrium, myometrium and the perimetrium. Endometrium is the innermost layer, endometrium inner layer, myometrium is the middle layer and the perimetrium is the outer layer. So sites of the implantation and the fetal development. Implantation occur in the endometrial layer. Now cervix and vagina. So cervix is the lower narrow part of the uterus, connects the uterus with the vagina, produces cervical mucus, dilates during childbirth. Vagina is the muscular canal about 8 to 10 centimeter long. Birth canal, it is the passage for menstrual flow, organ of sexual intercourse. Now external reproductive organ. External reproductive organ consists of mons pubis, labia majora, labia minora, clitoris, vestibules and Bartholin glands. So this is the mons pubis, the top part, clitoris, this is the most sensitive area, then the labia majora, the outer part, labia minora, the inner folds, then urethral opening, this is the urethral opening, then vaginal opening, the vaginal opening where introitus occurs, then the vestibules, the lower part is the vestibules, lower to the vestibules is the Bartholin gland. Then blood supply, hormones and functions. Blood supply is done through ovarian artery, uterine artery, vaginal artery. The main blood supply is done by the uterine artery. Ovarian artery, uterine artery and vaginal artery. The main blood supply is done through uterine artery. Then hormones is estrogen, progesterone, follicular stimulating hormone and luteinizing hormone. Now the functions of the female reproductive organs is helps in regulating the menstrual cycle, maintain pregnancy, develop secondary sexual characteristics, supports reproduction and overall health. So the key takeaways are: the female reproductive system is essential for reproduction and overall health. Internal organs include ovaries, fallopian tubes, uterus, cervix and vagina. External organs, that is the vulva, protects internal organs and play a role in sexual function. Hormones regulates the menstrual cycle and pregnancy and development. Proper care and awareness are important for maintaining reproductive health. So this is all about female reproductive system. Thank you.